In this video, we are going to talk about 5 things you must know about healthcare in the United States. So, before starting the video, please like this video. Do subscribe and turn on the notification to our channel for future updates. The dominant presence of the COVID-19 pandemic has, as of the beginning of the year 2020, reimagining the future of healthcare in the United States. It has uncovered 5 essential priorities that, when combined, have the potential to make healthcare in the United States more accessible, cheaper, and more focused on preventing illness rather than merely treating patients when they are ill. It is expected that some clinicians may oppose these priorities given that the healthcare system in the United States has traditionally been centered on the treatment of those who are unwell. However, one cannot avoid the consequences that result with COVID-19. Provider organizations that are resistant to change put their own futures as well as the futures of their patients in jeopardy. It is likely that the healthcare system in the United States faces the greatest challenges in terms of disparity and access when compared to that of other Western nations. On the other hand, hospitals in the United States are without a doubt among the most technologically advanced in the world. Here are 5 things that you really must be aware of to counteract all the negative information that we are hearing. 1. Quick access to the things you require. When you are staying in a hospital, everything you might require is within easy reach, and you have a better chance of receiving a prompt diagnosis than in the majority of other countries. It doesn't matter if you need a scan, the opinion of a specialist, or any kind of invasive treatment. Hospitals in the United States will get what you need promptly, frequently within hours. 2. Patient autonomy and choice in treatment. The concept of putting the patient first is more than simply a term. It's a common occurrence in healthcare facilities all around the country. Patients have the ability to inquire, get a second opinion, and, if necessary, lodge a complaint with an organization that will hear them out and responds appropriately. This is not the case in the majority of nationalized systems, which take a more authoritarian stance toward administration. Along the same lines, we consider it an article of faith that we are free to choose both the hospital and the physician who treats us when we need medical attention. 3. Comfortable environment. In practically every other part of the world, hospitals provide patients with superior levels of comfort and service. In several other affluent countries, it is not unusual for one large room to house as many as a dozen or more patients at a time. It is still a challenge in some industrialized countries to segregate male and female patients into separate waiting areas. This is a fundamental violation of patients' dignity. Let's not lose sight of how far we've come in the quest to make hospitals even more comfortable for patients by, for example, reducing the amount of background noise and providing food that is more appetizing. 4. Statistics. Overeating and a lack of physical activity, because everyone has a car, there's no reason to walk, are 2 examples of the many endemic chronic diseases that are a consequence of the country's wealth, which is ironic considering that wealth is one of the primary factors contributing to these diseases. An example of how one of your greatest strengths may simultaneously be one of your greatest weaknesses. Putting aside the negative numbers, which are obviously something that can be improved upon, did you know that the United States has among of the best survival rates in the world for those who have had a heart attack, a stroke, or cancer? According to a study that was published in the journal Lancet in 2007, it was found that American women had a likelihood of surviving at least 5 years after a cancer diagnosis that is 63% higher than the chance that European women have. Compared to 47% for men in Europe, the percentage is 66% for men in the United States. 5. Research, innovation, and entrepreneurship. The research and development capabilities of hospitals linked with American universities are unparalleled on a global scale. Many of the most cutting-edge drugs and technologies in the world are developed right here in the United States, and as a result, millions of people are able to lead healthier lives as a result. Some of these innovations include life-saving medications created by companies in the United States, as well as procedures such as stents for the heart. When it comes to the subject of physician entrepreneurs, many individuals believe that this is a situation that presents both opportunities and risks. It is obviously a negative thing if it results in incorrect prescribing of medications. What exactly is wrong with physician entrepreneurs when their work results in the development of novel ideas, cutting-edge technologies, and cutting-edge treatments? In many Western countries, especially those with more centralized administrations, this desire and motivation are in short supply. The tendency to take things for granted is ingrained in the human psyche. Does the healthcare system in the United States need to make significant improvements? Absolutely. In the long run, the cost of the system is not going to be able to be sustained, and we need to find a way to improve access for everyone. However, we are in a favorable position to begin. An examination of simplistic healthcare statistics, such as rankings of countries, can at times be deceiving and distort certain positive and negative aspects of the situation. So, that's it for today's video. What are your thoughts on our video? Please let us know in the comments section below. If you enjoyed this video and want to hear from me again, be sure to hit that subscribe button and turn on the notification to our channel before you go. Thank you so much for watching.